We ended the last lecture with shell shock, but we didn't really talk very much about treating it, aside from what we witnessed in Houston's extraordinary film. But let's rewind and look at how the condition was treated in the First World War. Or maybe let's look at the description that Pat Barker gave of one of the treatment modalities in her work Regeneration. Regeneration attempts to recreate the regime at the Craig Lockett Military Hospital, where shell-shocked officers were treated. W.H.R. Rivers, as we've seen, was one of the psychiatrists who worked there, and the book centres upon his relationship with some of his patients, the war poets Siegfried Sassoon and Wilfred Owen, and the fictional character Billy Pryor. Barker uses much of the book as a vehicle for exploring Rivers' agony at the irony of the fact that he was using therapy to make people well, to send them back to the front where there was a strong likelihood of them dying. This was certainly the case with Owen. But his methods were effective. He's understood from Freud, Janet and Charcot that trauma is at the heart of neuroses, so his job becomes a matter of talking through things with the shell-shocked officers, working out the origins of their psychic pain. Barker exploits this irony by counterposing the therapeutic regimes of Rivers and Louis Yelland. She does this by having them meet each other at the hospital where Yelland works. In real life, it was the National Neurological Hospital at Queen Square, London, but the film set is somewhere different. In the scene that follows, Rivers bears witness to Yelland's treatment of a soldier who has lost the ability to speak, known as aphasia. What follows is the film adaptation of the meeting.
And you only have one session?
Oh, yes. Patient has to know when he enters the electrical room, the only way out is by a full recovery. Mons, the man, Ain, first and second Ypres, Hill 60, Luz and Arras. Have I missed any? I've had dozens like you, Callan, dozens. Every one walked out of here fully cured. You will recover your speech. I usually do treatments alone. Last thing the patients need is a sympathetic audience. Now then, Cullen, I expect you to behave like the hero you are. A man who's been through many battles, has a good control of himself. I'm going to lock the door when the orderlies are gone. You will speak before you leave. There's no other way out. There is no alternative. Thank you. Nod if you wish to speak to me. Let's try ah and then ba. Now ah and ba. Ba. Ka da. Oh. Ka da. Ka da. Oh. Ka da. Ba. Ba. Ka. I'm gonna get you unstrapped now. Let you walk around for a little while. Silly man. I've told you how you may leave. It's the only way. I'm prepared to be here all day, all night. You're not the doctor. I'm the doctor. I'll tell you when treatment will start again. Now walk up and down. Come. Yes, yes, you can have water as soon as you've spoken your first word. Now get back to the chair. Now this time, the electrical charge will be applied to the larynx. You will find it very much more painful but it stimulates the very centers of speech. All right, a stronger current. I beg your pardon.
Stop it.
Say the days of the week.
Sunday, Monday, Tuesday.
Are you not pleased to be cured?
Yes, sir.
Nothing else?
Thank you very much.
Now, we know that Yellen conducted treatments like this. In fact, we know that he conducted this particular treatment because this was the first documented case in Yellen's book on the hysterical disorders of warfare. I guess it's neither here nor there that Barker and then the movie lifted large chunks of dialogue from Yellen's case study verbatim, although if you slow the film of Yellen's account down, you will see it ended somewhat differently to the movie. But what is more important is that this was a scene that was never witnessed by Rivers. I'm sure that he knew what was going on. I'm sure that he disagreed with it, but I don't think he ever witnessed Yelland in action. Barker's intention was quite clearly to juxtapose the humane treatment of Rivers' patients with the brutality of Yelland. The fact was that for much of the war in all the countries that were taking part in combat, similar methods to those used by Yelland were commonly employed. He may look monstrous, but his conduct was normal for an army psychiatrist, not least because he held to the degenerationist view of war neuroses. And of course, Rivers' method was kinder. It also turned out that it was more effective. Indeed, the combination of hypnotism, talking, and what could now be called occupational therapy seemed to work wonders with those suffering from shell shock. Let's return to some of the patients that we've already seen and how they were dealt with at Netley. Doesn't look that inhumane, does it? It was a therapeutic view that, notwithstanding the 1922 War Commission report, appeared to carry over into the Second World War. The clip that follows is not a Harry Enfield, Paul Whitehouse spoof, although it is real.
These bloody mortars chew anybody up.
Hello, Hargraves. What's the matter?
It's Ragson. He's bomb-heavy.
Right, send him down there. Take it easy, then. It'll be all right. What's the matter with you, Hargraves?
Wound in the arm, Sergeant.
Right. Hargraves, sir. Wound in the arm.
What did it?
Splinter, sir. Okay, lad. Take it easy. Have a cigarette.
Well, it'll be all right.
This is Mr. Sandiver, sir. It's about right.
It's okay, chum. It's all right. Come and sit down. Sit down.
Go and look after Hargreaves, Sergeant. I've put a dressing on and given him some tea.
Very good, sir.
What's wrong with you, Rag? Let's have a look at you. There's nothing wrong with your legs.
They're morphous, sir. Sorry, it was morphous.
Yes, I know. We've all heard them. Not very pleasant, are they? You've had a bit of a shaking. All right, Rag, all right. We'll soon fix you up. Well, there's nothing wrong here. I think it's just a shaking. Sergeant,
Sir?
is there any of that stew?
Yes, there is some left.
Well, give this chap a meal and barbitone, 10 grains. That's the 2 tablets.
Very good, sir.
You're going to be all right, Rag. Sergeant's going to give you a couple of pills and then some grub. Let's see what he looks like after that.
Okay, lad. Take these. That's right. Wash them down with the tea. Okay. Now come round the back and we'll get some grub. Up we come. Right, yeah.
You might take him round the back, Sergeant. He'll probably get some sleep there.
Yes, sir, I've done that. Just wondered if you like a mug of tea, as things seem to be quietening down a bit.
Thanks. Very interesting case, there. Rag, I mean.
Yes, sir, he was. What exactly was the matter with him?
He was a typical acute anxiety neurosis. You couldn't have seen a better example. He was acute.
And all he needed was a sedative.
No, we need more than that. As soon as transport's available, we'll whip him off to the Corps Exhaustion Centre. He'll only be a handicap the way he is now.
Will Corps evacuate him, sir?
Oh, I shouldn't think so for a minute. They'll keep him there for a week or two until this thing's cleared up and then send him back, perfectly fit again.
That's the drill for these anxiety cases, is it, sir? Send them to Corps Exhaustion Centre.
Oh, no, not always. Some cases are quite mild. Take a young soldier in his first battle, for instance. Well, we don't send them back. We give them a good dose of Madinal and several hours' sleep. The main thing is to get them early.
I see. I've often wondered how you tell when a man has one of these
Neurosis?
Yes, neurosis.
Well, it's pretty difficult at times. You see, there's so many factors involved in the production of anxiety. Physical things, exhaustion and infection, for instance, and the man's mental makeup. Everyone gets fagged out in time, of course.
But if you're anxious as well, then you'll get exhausted much quicker than you normally would. Sleep's the best antidote. It acts as a sort of shock absorber. It helps a bloke to keep his balance.
Yes, sir, but it's not quite so easy to just drop off to sleep in these parts.
You're telling me. It's even worse if you've too much anxiety. Then a fellow doesn't sleep properly, no matter how physically exhausted he may be. Anxiety is his trouble, and that's what keeps him awake. So the first thing to do is to give him a sedative. Not a textbook dose, but a whacking big dose to wipe out his anxieties and let him get a deep, proper sleep with no nightmares.
Have you had many cases of anxiety, sir?
Oh, more than you'd think. A lot of people get anxious very easily, but they're decent fellows and they try and hide it.
Like our driver, sir, Farrell.
Yes. Yes. You see, that sort of chap gets tired more quickly.
Taken from an instructional film entitled Field Psychiatry for the Medical Officer, it clearly indicates that battle stress was something anyone could get, although it tended to afflict the more imaginative than thick-skinned types. And the best way to deal with it was to give the sufferer an industrial dose of sedatives to rest their worn-out nervous system before sending them down the line to a special centre for treating nervous exhaustion. Yes, we will be seeing dangerous speculations and shocking treatments, but amidst it all, we're still able to find the pragmatism and humanity that is to be seen in Huston's film and the Netley and field psychiatry instructional material.